Okay, so this is the 8th ADGP National Forum, and the message here today is about the importance of partnerships in primary healthcare. And one of the strategies that we've undertaken is to rebrand from the Australian Divisions of General Practice to the Australian General Practice Network. Now, the reason we're doing that is to try and get the message across that, in fact, that we are a network of 119 divisions and 8 SBOs and the national organisation that work right across Australia to deliver local health solutions through general practice for better health outcomes for our patients. That's why we're rebranding, and working off that is a communication strategy, and that will see messages going out through all our divisions, through their local media to their local communities and to their local politicians, so that we raise the profile of the network, so that our communities know what we do, so our politicians know what we do, so that when we go to government to lobby on behalf of the divisions for funding for particular projects, we know that we'll be listened to and that we'll have a positive outcome.
You talked about making GPs the providers of choice. Can you explain a bit more about what you meant about that?
Okay, so it's not making GPs the providers of choice, it's actually making divisions of general practice the providers of choice to deliver those programs through our general practice for those local health solutions.
Can you give us an example, sort of an example of how you might see for the individual GPs how things might change them with the move to becoming a network as opposed to divisions?
Okay, so remember that our members are actually the divisions of general practice. Their members are their local general practitioners and allied health professionals, and in some areas their nurses. What we see is if we get extra funding and raise the profile of their local division, then that's actually going to empower them to actually better support their general practices, including their general practitioners and their nurses and their administrative staff, to actually improve the way that they can actually work with their patients. So that's the strategy. We actually work through our general practices.
And you talked about, was it ERM as effective resource management, or yes?
Yes, ERM. So ERM is all about effective resource management. So our basic line there is that we at present have a wonderful health system that basically has an uncapped expenditure on MBS and PBS. We're saying that that's not sustainable into the future, and we know from the work that's been done from the Productivity Commission, we know from what our state health ministers and our state premiers are saying, that if they really don't reduce the spend, or the rate of increase of spend, if you like, on health, that in fact by the middle of this century it will assume the whole of the state health budget. Now that's totally an unsustainable position. We're saying that through general practice, by quality prescribing methods, by looking at quality use of radiology and quality use of pathology services, by educating GPs and actually critically looking at the way they use those services, we think we can actually do a better job. And through that, we will actually achieve better health outcomes for our patients. And we believe that there will be a cost efficiency in doing that as well, and that we would then ask the government for a share of that saving so we can reinvest that into a local primary healthcare solution for our populations. That's what effective resource management's about. It's about providing increased services for our patients for the same amount of money.
Okay. And you talked about claiming the high ground, giving GPs a higher profile as well. I mean, can you say a bit more about that?
Absolutely. Look, I think it's well known that general practitioners are seen as the poor cousins, if you like, of our specialist colleagues. Now, from my perspective, I think general practitioners are a hugely valuable member of the health team. And in fact, what we want to do is raise the profile of primary healthcare in general in the country to increase the funding, because all the international literature and the literature in Australia shows that those economies that invest more of their health dollar in primary healthcare have much better health outcomes and actually achieve cost savings through that. I believe that in doing that, in recognising the great work that general practitioners do, then that will actually raise their profile as well.
Okay. With this raising of the profile and the sort of branding of the network, when's all that going to start, and when do you expect divisions to be starting to roll all that out? Is that immediate?
Okay, yes, that will start as of today. So today, every division across Australia, 119 divisions, have been handed a communication strategy which runs off the back of that rebranding exercise that we've gone through. So hopefully what will happen is that there will be a tying in of those perhaps disparate organisations into a more unified network that actually brings a message, a unified message to their local communities, but also to government at both state and federal level.
And can you go over those messages again about who we are and what we do?
Okay, so the message is our local message is that we are deliverers of local health solutions through general practice. So it's about delivery of services, it's about local because that's where we sit. Divisions are local regional bodies. It's obviously about health solutions because that's our business, and we work through general practice. So that's basically a quick summation of what we do.
And you said there was still some confusion, or people said today, about exactly what divisions are. I mean, of what they do. If you had to say in one line or two lines what we do, what would that be?
Okay, so we work through general practice to support the way that they look after their local populations. So we're really change agents and support agents for general practice. And it's really not surprising that our local communities don't know what we do, because mostly we're not deliverers of local health services. We actually work through general practice to support them deliver services. So we actually sit in the background a little bit. So what we need to do is raise our profile so we can actually better support our general practices.
And the other question there was of what we want. Somebody mentioned the Pharmacy Guild saying people knew what they want. Is there anything that the divisions want? Is there something?
Yes. What do we want? We want adequate funding so that we can continue to deliver these services. And that's really because we want the best health outcomes for our local communities. I mean, that's basically why we're in business. We wouldn't be there if that wasn't our ultimate goal. But to achieve that, you do need to attract funding so that you can actually do the work that you want to do.
Okay. And finally, any other take-home message for GPs watching?
Look, for all you GPs out there, I would say engage with your local division. If you don't know who they are, ring them up, get in contact with them. I think they will value add into your practice in a really strong and positive way. So I encourage you to support your general practice, get on board, get involved, and I think you'll be well rewarded.